My name is Anjali Rawat, and I live in Vancouver, British Columbia, and I'm a researcher based there in Canada. And I wanted to talk a little bit about the multimedia exhibit I have on clay plates and the inspiration for it and how it links back to health systems and primary healthcare. So I have an exhibition. It's kind of a juxtaposition of how temporary words are how temporary words are as researchers that we have from our research participants. And those words, although they're temporary and they're just spoken in the air to us, they often have a large impact on us and those who hear them, but there's no way to really share them with people. So throughout my research career, there's been certain phrases that have stayed with me, and a lot of them, so I've taken them and placed them on the most everyday object that we're all very familiar with, a plate. So by painting and carving them, I've turned these words into stone, onto stoneware in clay. And I'm hoping that inspires people to have some dialogue around some of the contemporary issues they bring up. For example, there's a woman who lost all of her children and her husband to the Ebola virus and in Liberia. And that's something that should have never happened. That was a failing of our health system. There's more on mismatched priorities between the drought response in Ethiopia, where people, donors and governments are coming in and saying, let's wash our hands and do sanitation, but there's no water and the people are searching for food. And then some of it's on my research in cervical cancer screening in Uganda, and how we're trying to screen women, but at the same time, there's stigma around whether their partners will leave them if they have cancer. And that's fear preventing them, as well as health system factors. So a common thread with just some of these plates that I've mentioned is primary healthcare access. And we do spend a lot of time looking at different, people are still, for years we've been talking about primary healthcare, but people are still very siloed. They're very, people are thinking in their specific diseases and the next emergency. And so I think we need to bring back the focus to primary healthcare and realize that that's the entry point for everybody's health, and universal health coverage is very important.